So now that you've done your frontal section here in the heart, notice that you see a thin wall, a thick middle wall, and a thick outer wall. Okay, so the thin outer wall, that's going to be the right ventricle, wall of the right ventricle. The thick middle wall is the interventricular septum. The thick outer wall is the wall of the left ventricle. So this space is right ventricle, this space is left ventricle. On the other side, this space is left ventricle, this space is right ventricle. Okay? Now, this space up here above right ventricle, this is going to be the right atrium, and then this flap of tissue that you see right here between the right ventricle and the right atrium, that's going to be the right AV valve or the tricuspid valve. See the same sort of thing on this side. Right ventricle, right atrium is up here. This flap is part of the tricuspid valve. See the tiny little strings attached to it? Those are the chordae tendineae. You see the bump that they attach to? That's a papillary muscle, okay, on the right side. Okay. Now remember, the right ventricle, when it squeezes blood into the pulmonary trunk, which is here. So I made this opening right here to show you the connection between the right ventricle and the pulmonary trunk. And then remember, there's going to be a valve between the right ventricle and the pulmonary trunk right here, called the pulmonary semilunar valve. So 1, 2, 3 flaps of tissue for that one. Okay. Left ventricle side. Okay. So you got a bit of left atrium over here. Looks like left atrium up here, left ventricle down here. So then this flap right here is the left AV valve or the bicuspid valve or the mitral valve. Also has chordae tendineae attached to it. Also attached to a papillary muscle. But look at how much bigger this one is. Okay. Now, left ventricle is going to squeeze blood up into the aorta. So you guys cut into your aorta. Let's cut right through the center of it. Most of it is on this side right here. Okay, so your aorta is up here, your left ventricle is here. So blood going up from the left ventricle into the aorta is going to have to go through this valve right here. That's the aortic semilunar valve. You're going to have the rest of it over here. So this is also aorta. So that's the other part of the left AV valve, or aortic semilunar valve. Sorry. Okay, and that's it.